This is Scott Becker with a special combined episode of the Becker's Healthcare and Becker Private Equity podcast. We're going to discuss today sort of the history, a short history of the surgery center world and business and development. It has a huge impact on hospitals and health systems. What we've seen there, there's almost 6,000 surgery centers that are Medicare certified today, almost 10,000 when you include all the other ones. It also has a huge impact in the business and private equity world. There's been lots of different investors in surgery centers over the years, including United Healthcare, which bought years ago SCA Health, which is one of the largest surgery center chains. So big impacts across the business world, the payer world, the health system world. Amber Walsh, brilliant leader at McGuireWoods, who has lived a lot of her professional career in the healthcare and surgery center and private equity world, is going to give us sort of an overview of some of the history of that world in this nice, short, concise podcast. Amber, let me ask you to take it away before I go any further on the intro. Amber Walsh.
Thank you, Scott. I'm fascinated by the history of surgery centers, and a lot of people think about surgery centers as a newer development. And in some ways it is, of course, compared to the history and the lifetime of the hospital industry. But what's really fascinating is that President Johnson signed into law in 1965 the Social Security Act and the foundation of the Medicare program. And almost immediately, within 1 year, there was a very significant discussion of the need for cost savings for outpatient surgery. So you see all of this discussion already in 1966, 67, and the first surgery center actually opened in 1970. It's very famous. It was called Surgery Center, opened by Doctors Reed and Ford in Phoenix in 1970. But over the course of that next decade, there was a really rapid proliferation. 100 ASCs opened all over the country where certificate of need laws would allow, but there was still no Medicare reimbursement. This is very fascinating because the need for that setting was discussed almost from the get-go of the Medicare program. We didn't actually have Medicare reimbursement until 1982. And then it was another decade, 1993, that the ASC safe harbors to the anti-kickback statute were really solidified, that kind of recognized the circumstances in which physician referrals or their invested centers were possible. And it's been very fascinating to see what's developed since then, but it really is a 55-year-old industry if you go back to that very first one in 1970. And it's been kind of consistent. Some changes, of course, in terms of what you can do on an outpatient basis. In fact, a lot of changes. I shouldn't give that short shrift. But it's been the same specialties that have kind of propped up and driven the ASC industry almost from the beginning. But I think that short history is just really, really interesting. And a lot of people, despite how much you work in healthcare, don't have a sense of that history.
And take a moment, Amber, and tell us, hospitals and health systems, how are they viewing surgery centers today? At one time, they sort of fought them. Different eras, they sort of worked with them to joint venture them. Other times, thought about value-based care and lower sites of service, but lower reimbursement. How are health systems looking at surgery centers today? Is there a sense of that, or is it just all over the board?
I think it's still all over the board. There are large health systems that embraced an ASC model, including joint ventured with physicians and with some of the larger management companies decades ago. And yet there are still health systems in the country that don't embrace an ASC model, or if they do, they want it to be a wholly owned ASC just owned by the system, and they don't believe in physician ownership. I think it's still across the board. Certainly pressures on cost containment, on your employee base, physician desires to have a different site of service, and certainly consumerism by patients seeking that setting have driven health systems more towards ASCs, not away, but it is still across the board all over the country. You see very different philosophies.
And then let me ask you the next question, because I think that's exactly right on that. Private equity funds, investors from the business side, where are they looking at surgery centers today? What are you seeing there?
Yeah, that's been really interesting. So I think that's changed more in the past 10 years. You've always had private equity investment into surgery centers. Some of the oldest large ASC multi-facility companies have been private equity backed for a very long time by Bain, KKR, et cetera. But what you have seen is a real sophistication developed around the importance of ASCs for physician practices and the best ways to have physicians still stay committed, excited, ready to get up and be, productive surgeons through their ASC ownership. That has really evolved over the past few years, where private equity investors understand more now, I think, than they did 10 years ago, why that continued ASC, not just credentialed for site of service, but the ownership is important to physicians. But you also see a sophistication by private equity investors on how to kind of combine their managed physician practices with surgery centers and anesthesia groups and interesting relationships with implant companies to form some unique bundles and value-based care. So I think it's really developed in a positive way, where there's more of a intelligence around it and a desire to really understand how the ASC fits into a surgeon's practice and can cut costs and be to the benefit of everyone.
Thank you. And tell us, where are we at today in terms of surgery centers? What are the big specialties? What are trends that you're watching currently? And are there some leaders in the area?
Yeah, absolutely. So the breakdown of specialties is a little bit different in single specialty versus multi-specialty centers. So from a multi-specialty center, orthopedics has been the big driver, both primarily in terms of revenue, but a little bit in terms of volume and OR time. Orthopedics has been one of the biggest for multi-specialty, along with pain management, ophthalmology, plastics, podiatry, ENT, OBGYN, and you even see a little bit of dental in surgery centers. Whereas in single specialty centers, it's much more driven by single specialty eye centers and single specialty GI centers. Now, of course, you do have some single specialty ortho, but the single specialty centers tend to be a little bit more in eye and endo because you just physically build out your plant differently. And that's been the case for quite a while.
Thank you. And what do you see in terms of pain management? Still quite busy in surgery centers, orthopedics, gastroenterology, ophthalmology. How does physician shortages play into the long run for a lot of this stuff?
Yeah, that's a really interesting point. And you're right, pain management, all of those still build up quite a bit. Physician shortages is interesting. I haven't really thought about that impact on the ASCs, but certainly the trend towards physicians becoming employed by hospitals, which continues to be and has been for a very long time on the upswing. A lot of times when physicians become employed by hospitals, they give up their ASC ownership, and you have a shift in the ownership and the operation of the surgery center itself. I imagine there's probably a resulting shift on where the physician chooses to perform their cases, but I'm sure that's something that a lot of hospitals and health systems deal with privately in their own employment relationships. It's an interesting question, though.
Thank you very, very much. And any surprises for you in the surgery center business? We've seen it go up and down over the years, but it keeps on sort of cranking along. Any surprises that you watch or anything that has surprised you in it?
I would say one of the most interesting things, and I don't know if it's a surprise as much as it's very interesting to follow, is every year there's not been a single year that's gone by in history, to my knowledge, where we haven't had a shift of the procedures that can be done in an ASC setting and the list of procedures that Medicare will pay for in an office setting. And it's one of the most interesting things to follow because there has been quite a push to move more into an outpatient setting, to approve more, be reimbursed by Medicare, and usually commercial payers, for the most part, not always, follow Medicare reimbursement. And for the most part, it's moved to the lower acuity setting, so from the hospital to the ASC, and in some cases from the ASC into an office where a surgeon can choose and a patient can choose a different side of service that saves the Medicare program dollars or a commercial payer dollars by moving settings. What's interesting is to see that list come out every year, to see the community reaction to that, but to also recognize a completely different phenomenon that a lot of people don't understand, which is just because Medicare will pay for a procedure to be done in an ASC and has declared it safe and worthy of their beneficiaries receiving care there, a lot of states, many states, don't necessarily follow that for what they believe is safe for the patients in their state. So you have this kind of disconnect where states are uncomfortable allowing certain procedures. Cardiac cath is a perfect example of one, where a lot of states won't allow it to be done in a surgery center setting. Medicare will pay for a lot of cardiac cath codes. And it's this kind of constant, there's a lot of politics with it, but there's also a lot of debate of well-minded people of what's good for the patient. And it's very, very interesting. And so the surprises, to answer your question, the surprises sometimes come from how long some of those debates continue in certain states where Medicaid a decade ago may have agreed to pay for something, and yet a particular state still won't allow it to occur in a surgery center. That, I think, is surprising and really fascinating.
Fascinating. There's also some states where either the Blue Cross plan or the big payer plan is really tough on surgery centers and forces a lot of stuff to offices versus surgery centers. Comment on that for a second.
Yes, no, that's absolutely right. You actually see that sometimes in some eye procedures. It's very interesting, and that is a third rail. That's a third dynamic. You have what's going on within the state that's often a battle between different types of clinicians and different types of providers that have kind of a stake in their own territory to want those procedures done in their setting. You have Medicare making decisions on a national basis, but then you also have that payer dynamic, and you're right, Blue Cross Blue Shield is a big one that will really push into a setting sometimes faster than Medicare wants it done for their beneficiaries in terms of pushing into the office. And it really creates this difficulty for providers to have to understand well beyond what they as clinicians believe to be the appropriate side of care. They have to understand what their state allows, what their key payers allow, where they're going to be able to do this most effectively and actually get paid for it, which, can create a real challenge sometimes.
Thank you very, very much. And Amber, anything else you wanted to point out today in terms of the world of surgery centers and hospitals? One of the things that's fascinating is how Tenet Healthcare redid itself in large part as a surgery center company and is really thriving again. Is it sort of combined with United Surgical Partners? It's sort of amazing what Tenet has done to rebuild itself as a surgery center company. Anything else interesting you wanted to point out with our listeners today from either the private equity side or the health system side?
Probably the main thing I would just leave you with is how much I love this industry, this constant evolution of the industry, but such an important part of healthcare everywhere. There's not a single congressman that doesn't have multiple surgery centers in his or her own district. It's very important very kind of critical and low cost part of our provider community. And I just loved working in it and constantly watching the evolution.
Again, Amber Walsh, thank you so much for joining us today on a combined episode of the Becker's Healthcare and Becker Private Equity Podcast. As good as it gets, getting to visit with Amber Walsh, one of the smartest, most disciplined people I ever get to work with. Just an incredible professional. Amber, thank you so much for joining us.
Thank you, Scott.